Well, we're privileged to have you in, Dr. Kincade. Thank you so much. She is a registered psychologist with the College of Alberta Psychologists in private practice here in Calgary, specializing in clinical psychology and neuropsychology. I think I said neuropsychology.
Neuropsychology.
Did I say it right? Okay.
Yeah, you got it right the first time.
Yeah. So people have a set of context. And again, I want to remind you, if you have questions for her, email us here at fan960@rci.rogers.com or jungle.jim@shaw.ca, and we will take your emails and ask her questions. What's your background in sport that gives you the expertise so that people know that the context is that you know what you're talking about? Because I know you know what you're talking about.
Well, the main background is that I'm a neuropsychologist by training, which essentially means that I'm kind of a brain geek. So it means I've spent a lot of time learning about what the brain does, what it looks like, what all the different parts of the brain do, so that when something happens to the brain, whether it be an injury like a concussion or some kind of disease like epilepsy or a stroke or Alzheimer's disease, that we kind of get an understanding of what's going on, what's working, what's not working, and how does that impact people's daily lives. So in terms of sports, a concussion is very simply a brain injury.
Christina, we're outnumbered now because Lisa and Dr. Kincade have more brains than you and I, because we've hit our head so many times now. There's a real brain drain going on here.
I won't comment on that.
We had several emails last week, and we had people write us in because we said we were going to talk about this. What is the phenomenon that's going on right now? Are we more aware of the concussions because the media can show us more, or did they always happen and we just didn't know about them, or does there seem to be an increase right now?
I would say it's most likely that there's more awareness about it. I think there's some people feel that, as sports become more and more competitive, athletes get faster, you see more violent hits. Some people would argue that there's more concussions now. I would argue probably more people are finally becoming aware of this as a problem, and that it's not just a minor incident of having your bell rung, but that it has pretty serious consequences. Can have pretty serious consequences.
Absolutely. We did get lots of emails, and I said I would read them. I promised these people they asked me to read them. So I want to read you this first one. It says, Jungle Jim, thank you for motivating all of us coaches and discussing the issues of injuries in the spirit of competition on your show. I'm looking forward to your next week's discussion. They wrote this last week on concussions. I'm a coach for a great group of 14 to 15-year-olds. My question for you is this. Please ask Dr. Kincade. One of my players received a concussion, was admitted to the hospital, and CT scan, and bleed was found. Stress and weather has also contributed to her headaches. She has missed a lot of school, and I am concerned. Could you give us coaches, parents, and players some insight into the recovery period, coping techniques, and feel-good stories? I have found myself constantly reminded every day about her condition and her challenges ahead.
Well, first, it's important to say that the majority of concussions that happen, especially in amateur sports, probably don't have the complications of having a bleed. So most are probably not as severe as the one that your writer referred to. But it does bring up an important issue, is that the recovery can range. So for a fairly simple concussion, it could be a matter of weeks. Maybe within a week to 10 days, the symptoms could resolve. But when you have more complex symptoms, when there's been a bleed, that it could take months up to a year or two to see some resolution of symptoms. The good news is that for most people with a concussion, if it's their first concussion, the majority of people can expect to recover. The period of time in which they can recover will vary, but the majority, within about a few months, up to, the more serious the injury, up to a year, and at the far end, up to a couple of years. And there are some people, sadly, who will have some side effects after that period of time.
Now, with regard to, kind of in layman terms, if we're going to talk about what is a concussion, because when we refer to, say, a punch in a leg, we have a blue spot, and then potentially, the blood starts kind of seeping away and then changes color and then it goes away. But sometimes you might have some residual, like scar tissue in the area, then it forms a little bit of a lump potentially, and then it might even turn into a piece of bone, So how exactly, if you have people kind of think of that side, which everyone pretty much knows about, and then refer it to the brain itself. Like, what are the different types of levels and residual problems?
Well, I'm really glad you mentioned that, because I think it's one of the big reasons that people overlook concussion sometimes, because exactly as you said, if you have a punch or a cut, you can see there's redness, there's swelling, there's a bruise, you can see that. In the brain, you can't. And also, the brain has no pain receptors. So you can have that injury in the brain, but you don't feel what's going on because there's no pain receptors there. So it makes us much less aware that an injury has happened. So it makes us tend to overlook and the effects, because the brain is so complex with how it controls behavior and thinking. We don't always understand and attribute some of the changes we might have with thinking and behavior to the injury that's happened in the brain. So when there is an injury, it depends on the extent of the injury. So it could be that, if it's a fairly mild hit, the changes could be just metabolic changes initially, meaning that there's changes in how neurochemicals are released in the brain for short periods of time. There's just alterations in how the brain cells are working. And that can cause some alteration in thinking skills for a short period of time. If the injury is more severe and it's more like a bruise, there could be some broken blood vessels in there, and then the body has to go in and try to heal those. When you start getting some swelling going on in the brain, that's where it causes some problems, because the brain is basically like the consistency of a hard jello, sits inside some fluid inside the skull, which is very hard, obviously. So if there becomes swelling and the brain starts to expand, it doesn't have very far to go. So that's why when there's swelling in the brain or bleeding in the brain, it's very important to get attention right away, because as soon as it starts expanding and getting pressure against the skull, that's when you can really start seeing some serious damage. So that's why it's important for people to continue to be monitored shortly after, because if the swelling increases in the period after the injury, then it needs medical attention right away.
Wow. There's a lot to that.
I am a brain geek, right?
Yeah.
Very good one.
I just want to sit here and listen, because,
Is your brain full yet?
No, it's not. I mean, mine's empty. I cracked mine. I had all of those things, and I'm trying to figure out, okay, how am I even alive? So, I want you to, if you have some advice, and we'll come back right after the break. The music is going. Lisa's telling me to wrap it up. I know, I got to go. But when we come back, I want you to tell me if you have some thoughts on what this coach could do, or what the players could do, or what the parents could do to encourage this girl. Because I can see it negatively affecting, and this is the area that I work in, is I can see it negatively affecting performance of the athletes and the team. And when we come back, we'll talk about that. You're listening to the Jungle Jim Hunter Show on Sportsnet Radio, the Fan 960, and fan960.com. We're talking to Dr. Michelle Kincade, and we're talking about concussions and what to do when they happen. And we'll take your calls, your emails. We got some emails that we want to address after the break, and we're going to talk to Dr. Kincade about what you can do and some of your questions. Email us here at fan960@rci.rogers.com or jungle.jim@shaw.ca, and we'll take your calls later in the second hour, and second segment and third segment at 403-240-4444. We'll be right back after this.
This is the Jungle Jim Hunter Show, only on the Fan 960, Calgary's only all-sports radio.
Things change only when people change. I know, that doesn't seem very earth-shattering, but I got news for you. We're the stewards of this planet. And unless we